Talking to a doctor in English is hard, even for very good English speakers. When you're nervous, the words are gone. And suddenly you're saying, I have a hurt in my foot fingers, instead of what you want to say. But it doesn't have to be like that. I'm here, Dr. Luke, the doctor of your English brain, I guess. Anyway, in this video, I will give you real English phrases that native English speakers actually use at the doctor, organized step by step. Later, we'll do a full role play using the phrases we learned, and I'll share a way to practice this situation for free using ChatGPT. Don't forget to like and subscribe if you enjoy the video, and check out the 7-day challenge in the links in the description. So first, opening the appointment. At the very beginning of your appointment with the doctor, maybe you need to give some context, and maybe the doctor already knows what the issue is. You could say something like, I booked today, maybe it was a last-minute appointment, I booked today because something's changed with. So the doctor already knows what the issue is, but now something is different, and that's why you're here. You're giving that context. Something's changed with my migraines. They're hitting twice as often this month. Or maybe you could say, hi, Dr. Chen, thanks for seeing me on short notice. Maybe you had to book the appointment today, this morning, because of something you feel is urgent. Maybe I've been worried about a tight feeling in my chest that keeps coming back. That would be something to worry about. Now let's talk about describing the symptoms. These are the things that you're feeling now or have been feeling recently. The reason you're here at the doctor explaining your symptoms, right? So you might say something like, for the past 4 days, this is important, this gives the length of time. For the past 4 days, I've had a burning sensation right behind my breastbone. Okay, so the doctor doesn't have to ask the follow-up question, how long has this been going on? That's a really nice way to say it. Now, if you want to kind of describe the pain, you could say something like, the pain is, and then what kind of pain it is. Burning, dull, sharp, something like that. Or maybe it changes throughout the day. The pain is dull in the morning, but sharp by late afternoon. Dull in the morning, but sharp by late afternoon. If it changes when you do something different, you might say it eases if I sit upright, or it gets better if I sit upright, but seems to flare up when I lie down after meals. To flare up means to get worse, to increase in intensity. So that's a good way to talk about how it changes, to give the doctor a really clear idea about what's going on. Now, how can we talk about severity and triggers? You might say something like, most days it sits at a 4, but yesterday it spiked to a 7 after lunch. So generally, we can use a scale out of 10. Doctors will sometimes ask, out of 10, how severe is the pain? So it sits at a 4 means that's the typical level. And then if it spikes or drops, that means it changes. It drops to a 2 when I brush my teeth. What could that possibly... Trying to think of medical conditions that could drop to a 2 when you brush your teeth. I don't know. But it spikes to a 7 when I'm not brushing my teeth. Or after lunch, for example, it spiked to a 7 yesterday after lunch. You might say it started 2 weeks after I switched to a high-intensity workout class. So maybe I've been taking fitness classes. I switched to a different type of class. I don't know, what is a high-intensity workout class? I don't even know what that would be. But I switched to that, and 2 weeks after that, this happened. It started. Again, this is possibly a trigger. I'm trying to give the doctor information to let them know what could be the cause. Maybe it's stress. Stress at work seems to bring it on. That's a very good phrase. Stress at work seems to bring it on, especially right before deadlines. Okay, so an important maybe factor being stress. What about sharing relevant medical background information, things that the doctor might want to know about you that were true before this happened. I was diagnosed with mild asthma last year. Right now, I take some medication, 10 milligrams once daily. Okay, so maybe they'll ask about that. Usually the nurse or the assistant asks about current medication, but you might explain that. And you might give family history. You could say, my dad and older sister both have type 2 diabetes. That's important context and background information. Now, sometimes the doctor will say something and you don't know what it means. Maybe it's a medical word, a technical word, a jargon word, and you just don't know it. Easy enough. Ask for clarification. Could you walk me through what gastritis actually means? Just say that, right? Could you walk me through what this word I don't know? Could you walk me through what that means? Now, walk me through means kind of step-by-step explain it. Don't just give me a simple definition. You could also say something like, could you just explain what, whatever that is, means? Could you just explain what that means? Or I guess you could say, I'm not familiar with gastritis. Could you explain that? Something like that. Now, perhaps you've been given a medication or something and you want to ask a follow-up question. If I start this medication, what side effects should I watch out for the first week? Or you could just say, what side effects should I expect? Or what side effects might I experience? It's a good way to ask a follow-up question once you've been prescribed medication. Now, sometimes we like to be our own doctor. Maybe we've done some research before. I'm definitely very guilty of doing that. I often do a lot of research. I'm a bit of a hypochondriac. It used to be worse. I still have it a bit. It comes and goes. So maybe I've done some research about diet, and I want to ask if maybe that's a good idea when I'm talking to the doctor. Would a diet change help, or is medication the best treatment? Maybe I want to avoid medication, and I want to see if possibly we could try a dietary change first. Would this work? Would that be a good idea? Do you think I could do this? Do you think I could try changing my diet, maybe less sugar for a couple of weeks and then come back and see if anything has changed? And of course, the doctor will then backhand you across the face and say, no, just do what I say. It can also help to confirm instructions. We want to make sure we didn't misunderstand something. So this is a great phrase. So, just to be clear, it's one capsule right before breakfast for 2 weeks, right? Now, of course, it should say that, but hey, you're talking to the doctor, you just want to ask. Just to be clear. Maybe you say, you said to avoid ibuprofen. Is it ibuprofen or ibuprofen? Ibuprofen? That doesn't sound right. Ibuprofen? I've always said ibuprofen, but I think it might be ibuprofen. It's spelled like that. I don't know. You said to avoid ibuprofen while I'm on this. Does that include topical gels? So maybe a clarification there, right? So maybe just making sure. Did you mean the actual pills that I could take, or every type of ibuprofen, whatever it's called? Should I book the blood test here or at the lab across the street? Should I book the blood test here or at the lab across the street? Again, this is all follow-up, making sure we understand instructions, clarification, all very important. And I love the phrase, so just to be clear. That is a fantastic phrase. If you remember one phrase from this video, that might be it, because it's a great way to clarify things. All right, let's try a role play. Hi, doctor. Thanks for taking this appointment on short notice. I've been worried about my allergy symptoms since they've been getting worse, even after you prescribed that medication last week.
I understand. Thanks for coming in to talk about it. Can you tell me more about what symptoms are getting worse? For example, is it more sneezing, congestion, itchy eyes, or something else?
I've been experiencing really serious sinus congestion and sneezing constantly. Nothing with my eyes or throat, though. It's just the sinuses.
Got it. So mainly sinus pressure and nonstop sneezing. How long after you started the medication did you notice it wasn't helping? And are you taking it every day as prescribed?
I'm taking it exactly as prescribed, and it's usually more serious in the morning. And to be honest with you, The symptoms have not really let up at all. It's just really bad in the morning, gets a little better in the afternoon. And if I'm indoors in a well-sealed room, it seems to be much better.
Thanks for explaining that. Based on what you're describing, it sounds like something in your environment, maybe pollen or dust, is triggering your symptoms, especially in the mornings. That might explain why it improves indoors in a sealed space. Have you noticed if anything specific, like being near open windows or going outside, makes it worse?
It doesn't really get worse when I'm outside. One thing I do want to mention is my father had really, really bad seasonal allergies, and I've had them since I was a kid. It's just disappointing that the medication you gave me didn't work.
That family history definitely helps explain it. Seasonal allergies can run in families, and they sometimes get more intense over time. It's frustrating when meds don't give relief, especially if you've been managing this since childhood. Some patients with tough allergy cases try combining medications or adjusting when they take them. Others look into allergy testing to pinpoint exact triggers. Would you be open to discussing those kinds of options with a specialist?
I guess I could see a specialist, but I'm wondering, is there anything that you could prescribe me that might work that would be different than the last medication?
I hear you. It's natural to want to try a different option. That said, since this is a language learning simulation, I can't prescribe anything or suggest specific drugs, but many patients in your situation explore things like nasal sprays, antihistamine combinations, or even allergy shots through a specialist. Have you ever tried any of those before?
My father, I think, did the allergy shots, and that worked for him. But could you explain one thing? The allergy shots, doesn't that happen over a long period of time?
Yes, exactly. Allergy shots, also called immunotherapy, usually happen over a long period, sometimes several years. They involve getting regular injections of tiny amounts of the allergen, gradually training your immune system to become less sensitive to it. It can take a few months to start noticing results, but for many people, it really reduces symptoms long term. Would that kind of gradual approach feel manageable for you?
Okay, so just to be clear, would I have to usually come into a clinic to get the shots, or would I do that at home?
Good question. Usually, you'd need to go into a clinic for the shots, especially at the beginning. That way, they can watch for any reaction right after the injection. Over time, some patients can stretch out the visits if things go well, but it's generally not something done at home. Does that fit into your schedule, or would regular clinic visits be tough?
I think I could manage that. So I'll take your recommendation if you could give me a referral. I really appreciate it. Thanks, doctor. All right, so try out the role play for yourself. I really believe that learning is just one step. You also have to use what you learn so that it really sticks in your mind. And I think doing a role play is a great way to practice what you learn. So check out the GPT in the description. If you have any questions, let me know. Also, check out the 90-day program in the links in the description. It's the best way to improve your English fluency in 90 days. Again, if you have any questions about that, let me know, and I will see you in the next one.